Vitamin A, you invisible hero. Everything you need to know about the forgotten element. Vitamin A. The eye vitamin. Vitamin A is a fat-soluble vitamin that is essential for a variety of important functions in the body. It plays a crucial role in eye health, growth and development, reproduction, the immune system, and cell communication. In this text, we will take an in-depth look at the different aspects of vitamin A, including its functions, sources, deficiency, and overdose symptoms. Functions of vitamin A. Vitamin A serves several important functions in the body. One of its most well-known roles is in maintaining vision. It is an essential component of the visual pigment rhodopsin, which is responsible for vision in low-light conditions. Vitamin A also helps maintain cornea health and helps reduce the risk of night blindness and other eye problems. In addition, vitamin A plays a crucial role in promoting growth and development. It is important for cell division and differentiation, which means that it is involved in the formation and maturation of tissues and organs. During pregnancy, sufficient vitamin A is especially important for the development of the embryo. The immune system also benefits from vitamin A. It supports the production and function of white blood cells, which play a key role in fighting infections. Vitamin A also promotes the integrity and function of mucous membranes, which serve as a barrier against potential pathogens. Sources of vitamin A. There are two forms of vitamin A found in food: retinol and provitamin A carotenoids. Retinol is the active form of vitamin A and is found primarily in animal products, such as liver, milk, eggs, and fish. Provitamin A carotenoids are converted into retinol by the body and are found in plant sources such as carrots, sweet potatoes, spinach, and kale. Vitamin A deficiency symptoms. A lack of vitamin A can lead to a number of health problems. Night blindness is one of the first noticeable symptoms of deficiency. Sufferers have difficulty seeing in dim light. In advanced cases, vitamin A deficiency can lead to xerophthalmia, a serious eye condition that can lead to blindness. In addition, a deficiency can impair immunity and increase the risk of infections. What functions does vitamin A have in the body? Vision. Vitamin A is essential for eye health and vision. It is a component of the protein rhodopsin, which is present in the rods of the retina and helps process light information. Immune system. Skin. Symptoms of a vitamin A deficiency. The eye vitamin. Acne, breathing difficulties and anemia, growth disorders in children, weakened immune system, hair loss, frequent throat and chest infections, fatigue, lack of concentration, performance degradation, vision problems, problems with the mucous membranes. Basic information. Vitamin A. There are two types of vitamin A used in the body: retinol and carotenoids. Retinol is the active form of vitamin A and is derived primarily from animal products such as liver, egg yolks, fish, and dairy products. Carotenoids are a group of compounds found in plant foods, particularly carrots, spinach, broccoli, sweet potatoes, and peppers. The body can convert some carotenoids into retinol, but not all of them. Adequate intake of vitamin A is important for vision. Retinol plays an important role in the synthesis of rhodopsin, a pigment in the rods of the eye's retina that helps to see images in low light. A deficiency in vitamin A can lead to night blindness, a condition in which the ability to see in the dark is impaired. Vitamin A is also important for the immune system. It helps keep the body's skin and mucous membrane barriers intact. thus protecting against infections. It also plays a role in the production of antibodies and in the activation of white blood cells. For children, vitamin A is important for growth and development. A deficiency in vitamin A can affect growth and development and lead to delays. It can also lead to increased susceptibility to infections and diseases. Pregnant women and nursing mothers have an increased need for vitamin A. A deficiency in vitamin A during pregnancy can lead to complications such as low birth weight and an increased risk of infections. A deficiency during breastfeeding can also affect the quality and quantity of milk. Although vitamin A is important, excess retinol can be toxic. Too much retinol from supplements or too much liver can cause symptoms such as nausea, vomiting, headaches, and dizziness. In pregnant women, too much retinol can cause malformations in the fetus. Recommendations for daily vitamin A intake vary depending on age, gender, and pregnancy status. Overall, vitamin A is an important nutrient for the body that is found in many different foods. A balanced diet rich in vitamin A containing foods can help maintain adequate vitamin A status. These could be possible symptoms of an A deficiency: dizziness, dry eyes, thickened, dry conjunctiva, dry skin, nausea, bumps, light skin pimples on the upper arms, keratinization of the mucous membranes in the respiratory tract, hornification of the mucous membranes in the area, the digestive tract, hornification of the mucous membranes in the area of the urinary tract, reduced sense of smell and olfactory disorders. Vitamin A is very important for the health of bones, cartilage and teeth. Do you know vitamin A? There are two types of vitamin A, retinol and carotenoids. Retinol is found in animal products like milk, eggs, and liver, while carotenoids are found in plant foods like carrots, spinach, and sweet potatoes. The body can also convert carotenoids into vitamin A when it needs them. It is important to meet your daily vitamin A requirements, but overdose can be toxic and cause harmful side effects such as headaches, dizziness, nausea and liver damage. How much vitamin A do we need? Dosage according to DACH reference values. If you have a deficiency, you should see a doctor and have a blood test done. As vitamin A deficiency is not very common, it is very important to follow the dosage exactly. You can ask a pharmacist for advice on which nutritional supplements are available and how best to take them. DACH reference values. The recommended daily intake for adults, 25 to 51 years per day according to the DACH reference values is 0.8 mg, women, and 1.0 mg vitamin A, retinol equivalent. Pregnant women have an increased need from the 4th month onwards. The recommended intake is 1.1 mg per day. Breastfeeding women are recommended to take 1.5 mg per day. The estimated range for the intake of Greek letter beta carotene is 2 to 4 mg per day. Too much vitamin A. Overdose. Caution. An overdose can cause serious damage to the body. Severe headaches, liver enlargement, liver damage, nausea, vomit, many other serious damages in your body. If you suspect a vitamin A deficiency, it is important to go to the doctor and have a blood test done. Which foods contain vitamin A? Apricots, avocado, fish, meat, pork liver, high value 36 mg, liver dumplings, chicken liver, carrot only 1 mg, cheese, milk, nuts, olive oil, red, yellow vegetables, spinach, kale, carrots, pumpkin, tomatoes, lamb's lettuce, green beans, broccoli. I have attached some delicious recipes for you and a smoothie recipe. Which herbs contain vitamin A? Basil, dill, cress, lovage and fennel, rosemary. Tip: you can find organic herbs in the garden center or in good organic stores. Smoothie recipe: carrot burner, 2 carrots, 1 large apple, 120 milliliters mineral, healing mineral water trace elements, 6 oranges squeezed, 1 tablespoon basil as needed. Put everything together in the blender and then enjoy in a glass. Recipe: vitamin A, vegetable rice with spices. Ingredients for 1 serving: 50 grams rice, 10 grams fat, corn oil, 40 grams peas, chilled vegetables, 1/4 tablespoon salt, 110 milliliters of water. Preparation: briefly steam the rice in hot fat. Pour water over it. Add peas and rice and steam on a low heat until the water has completely evaporated. Recipe: vitamin A, various vegetables in the oven. Ingredients for 1 serving: 200 grams frozen vegetables, depending on taste, 1/4 liter vegetable broth, 1/4 stock cube with 1/4 liter water, 50 milliliters yogurt, 1 egg, 25 grams cheese, toast cheese, 1 pinch of pepper, 1 tablespoon of oregano, 1 pinch of salt. Preparation. Step 1. For the delicious gratin, preheat the oven to 200 degrees. Step 2. Boil the vegetable stock in a saucepan. Then add the frozen vegetables. Boil briefly. The vegetables must still be firm to the bite. Strain and put in a dish. Slowly mix the yacht, egg and spices and mix over the vegetables. Sprinkle the gratin with cheese and put in the oven for 20 minutes. Step 3. Completion of the dish. Serve the gratin on a plate and garnish with basil. Recipe: vitamin A, spicy vegetable soup with fried toast. Ingredients for 1 serving: 150 grams chilled vegetables, as desired, 1 liter of soup broth, 1/4 onion, 1 teaspoon oil, 1 slice of toast, 1 pinch of nutmeg, marjoram, thyme, salt and pepper, 1 tablespoon butter, 1 pinch of herbs from Provence. Preparation. Step 1. Prepare the soup. In a large saucepan, sauté the onions with the oil until golden brown. Add the chilled vegetables and stir briefly. Add the soup stock and seasonings to taste. Cook on a low heat for around 20 to 30 minutes. Step 2. Preparing the toast slice. Spread butter on both sides of the toast slice. Add the herbes de Provence. Fry on both sides in a non-stick pan. Step 2. Completion of the dish. Serve the soup in a soup bowl with the fried slice of toast. Rights and ownership notice. This audiobook is published and distributed by Testbericht-Institut LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testbericht-Institut LLC. Testbericht-Institut LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testberichtinstat LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testberichtinstat LLC. All rights reserved.